Hello, everyone, and thank you for joining us this evening for the second week of Rugby Research and Injury Prevention Group 2026 Summer Lecture Series. We are going to start tonight with our featured speaker, Dr. Coleman. Dr. Coleman is an associate professor of pediatrics pediatrician, and a sports medicine physician at the Children's National Hospital in Washington, D.C. Dr. Coleman, when you're ready, will you please share your screen with us?
Okay, can you see it? Okay.
Yes, ma'am.
Okay, well, welcome this evening, everybody. It's good to be here. Thank you for having me again. So I'm going to give a talk today about youth sports at a crossroads, right? There's a lot of stuff going on for our youth right now. That's good, but then some maybe that's not as helpful for them. Okay, so we're going to start with a case, as we usually do in medicine. So we'll start with a 14-year-old soccer player who comes in for a routine sports physical for soccer. She's a straight A student. She's on the club team. She's on the school team. She's a private trainer twice a week. So she's doing a lot with soccer. When asked what position she plays, she says wherever they need me. So she's just all in on soccer. When asked how many months she plays per year, she says all of them. So really no break at all. Her mom says probably, she loves it, right? And a lot of our parents are really proud of us when we do sports. And she wants to play in college, right? And so a lot of our parents are also excited when we play sports really well because that might be an avenue of getting to school. Uh, but when you ask does she have any pain, she says, "Oh, my knee hurts sometimes, but that's normal." And unfortunately, I see sometimes where there are teams where everyone on the team has knee pain. Somebody will come and say, "Yeah, I have knee pain, but my teammate also has knee pain. A lot of us have knee pain." It's like, well, that's not normal, but sometimes it's kind of accepted among the athletes. When asked about the sleep, she says, "Well, I'll sleep after the season, but if we go back to when she plays all the time. So that's a concern if she's not actually gonna get a time where she can catch up, which is difficult anyway." And then when asked if you stopped playing tomorrow, who would you be? She couldn't answer. Nothing, right? And that's because her whole world is soccer, and that's concerning, right? And so that's what we're going to talk about today. So, youth sports, when we think about it and we think about clearing people for sports, it's not just about like knee pain that this young lady has. It's about their identity. It's about the pressure they feel, the risk that they take. And our role as pediatricians or providers of that care for athletic youth. So by the end of the session, hopefully everybody will be able to describe the relationship between early sports specialization, rapid training load increases, and overuse injury risk in youth athletes. Apply a brief counseling framework to assess burnout, overtraining, and sports-related mental health risks during a pre-participation physical exam like this young lady was having. And formulate an approach to shared decision-making when performance goals conflict with long-term health, right? And that can happen too. So we'll do a poll. So first, at what age do you believe specialization in a single sport becomes appropriate? Before they're 10, from 10 to 12, 13 to 15, uh, high school only, or it's never appropriate or never necessary. What does everybody think?
Well, in my opinion, I think it's about C.
Okay. Mhm.
I would also agree C or D. I believe never necessary can't be the answer just because that would be too many things to handle at once.
Okay. Okay.
I agree as well. I think C is about the right age because, especially with professional sports, you kind of have to specialize to be able to reach the level necessary to play even D1 or D3 college sports.
Okay. Yeah, so are you guys thinking about the evidence on specialization? Are you thinking about experience, like your own personal experience or somebody you know who went into sport, specialized in a sport, or are you just thinking about kind of what's done already?
Partly my own experience because I was a swimmer and I think I started too late, basically when I was about 16. So
I can talk from experience. I think it's either A or B. I play soccer, so there's elite academies that are already from like under eights, under sixes. So for me, I would rather lean towards A and B.
Okay. Okay.
I lean towards C or D. I think that like there's tons of pro athletes that like we've seen played like tons of other sports. Um, up until they were like, upperclassmen in high school, and then they specialized into one sport, then still ended up going pro because it's like they were naturally talented or they just, showed hard work and ethic.
And for those of you who participated in sports and did you have one of your providers, one of your, like when you went to the pediatrician or you went to family practice doc or for your sports physicals, did anyone say, oh, it's be careful about specializing too early or overtraining? Did anyone get talked about um, that? No? Okay.
I
Okay.
Well,
did.
Uh-huh.
I,
Oh, yeah.
I did. I ran track and field and I also danced at a very high level for both over a decade, starting way before age 10. And it got to a point right before high school where my physicians and my health team basically told me, like, you have to pick one because this is too much.
Were you having injuries or they just looked at the
Yeah,
volume
I was very injured
Okay.
all of the time.
Okay. Yeah. And I think it tends to happen then, right? When someone has an injury, it's like, wait, what are you doing? And then we'll kind of have that talk. But a lot of times we don't necessarily talk about it before and kind of, when people are just starting into sports. Okay, well, let's see. So when we think about early sports specialization, no one has an exact age or anything like that, that they say, oh no, this is too early. But we do have a general feel. And we think of early sports specialization as year-round participation in single sport before puberty. So a lot of times when people said, 13 to 15, that's around puberty. So you guys got it right. Participation in a sport that requires early skills development is one of the reasons people say, right? So, I needed to do it early. So people who do, certain sports will say that, or they'll say, I really wanted to do really well, right? I wanted to go to college with this sport. I wanted to be in the Olympics with this sport. I wanted to play pro with this sport, right? So all those things had people kind of, doing it early. So there are sports, and actually you guys have named some of them in your participation in them now, right? So various dance and gymnastics careers actually kind of people benefit in a way from starting early. Same thing with other sports like hockey and soccer. Same thing. If they start earlier, you get in those leagues and you kind of get filtered up that way. You get more support. And the unfortunate thing is that we give everybody all this support. We have them doing all these different things, and then it can backfire, right? There's an increased risk of overuse injury. As Danielle had mentioned, there's also a likelihood of burnout. And burnout is one of the leading causes of youth sport dropout, right? So we try to do all these things, and then in the end, it backfires, right? So when you're thinking about overuse, we have to start thinking about training loads, and it should be appropriate for the person, right? So it should be for the athlete's age, their current level of activity, their developmental level too, depending on the age of the person, and then it can kind of gradually advance from there. The interesting thing is that we see people who obviously have a high training load who have injuries, but we also see people who had a certain training load that they were kind of carrying for a while and then they change. And that change can also, so that kind of rapid training load spike can also cause issues with injury. So we'll see that when somebody goes from, being in grade school and they play some soccer and then they hit high school and they start playing on the school team and the club team, and that's a big change in training load, and they're more likely to have injuries just from that big change, and they haven't adjusted yet. So when we think of overuse injuries, and yeah, you might have experienced some of these yourselves, you could have an apophysitis or apophysitis, which are irritations at a growth center that's attached to a tendon. You could have a tendonitis or a tendinopathy, just muscle soreness, right? Just sore all the time, stress fractures. Those are all types of injuries that you might be diagnosed with if you have an overuse injury. And then, those who have overuse injuries can also kind of develop burnout. And people with burnout can also present to the doctor for different things, right? So they can present with decreased appetite, decreased sports performance, decreased school performance. So it's not just affecting their sport, but their school life as well. Decreased interest in anything, right? So other activities that they used to do, they don't find fun anymore. And then there's just fatigue, and they can have vague pain. They can get sick a lot. They have difficulty completing their work, and then they can have mood changes. So all of these things can come from just overdoing their activity that they liked in the beginning. So injury risk is, we always think, oh, you got hurt. Oh, it was just an injury. It was an accident, but not necessarily. If we've got somebody who's overdoing it consistently, we can predict, that their odds are they're gonna have an injury during their season. Are you guys liking my GIFs? I love a GIF. Okay, here we go. Let's see. So we'll do another poll. So there you have an injured athlete who becomes withdrawn. They're irritable during their recovery. Which one of these things do you think is causing, that kind of withdrawal and irritability? Normal frustration, loss of identity, fear of losing the position, fear of, underlying depression, or all of the above?
I think all the above, but I would put an emphasis on B. If they're so devout to this, or if they have so much love for the sport, they lose their identity because the sport is their identity. And if they have to sit out, it's tough for them.
I would also say E, but I would also put more emphasis on C because as an athlete myself, fear of losing position on the field, being the starting lineup, it's a big loss of character and just a big loss altogether.
Anyone else?
I would also put E just because I feel like most of these come from as a result of like overthinking the injury. And I feel like that's a big factor that might like dip into each category.
Yeah. So and so I think you guys, you guys have got it, right? So all of those things, either together or individually, can lead to somebody being different when they're having an injury and they're having to recover. So when we think of mental health in sport, we have to think, well, if and first, it's a good thing to be in sports. It's a good thing to be part of a team, right? It can actually be good for your mental health. However, if you're in a high pressure environment, then you might have more anxiety with your sport. You might be trying to be perfect in your sport and you're not doing it right. And that's when, you hear about people who get like the yips and stuff like that. And then you do have a risk for that negative identity perception, right? If you can't do what you wanted to do, you can't be in the position you wanted to be in, you can't be starting as you had expected. All those things would negatively impact your identity. So what is athletic identity? It's the athlete's sense of self that is associated and defined by being an athlete, right? So it can be good, right? So it can help you focus on certain things so that you can accomplish a goal. It helps you persist when things are hard. It helps you maybe have healthy lifestyle behaviors. You might have a healthier diet than the average non-athlete would. You might aim to get more sleep, be more hydrated. And then you also feel a part of something that's bigger than you. So those are all good things about a high athletic identity. The risk, though, is that if you lose your status as an athlete, then you risk, mood disturbance because that sense of self, if you have a high athletic identity, is gone. Right. So there's ways to balance, and these are things to kind of think about in your own athletic career, and also when you're talking with other athletes, is just focus on other life activities. There's other things that we do, right? We have a family, we have friends, we have hobbies, we have school. We have a lot of other things that can be part of our identity. So if we lost one, we would have others that also could help us maintain a sense of self. So back to the case, this young lady who came in. So she specializes in one sport, right? Soccer, soccer, soccer. She plays more than 11 months a year, so all year, no breaks. She reports, though, that she feels behind her teammates, so she's not keeping up. So that's concern, right? So maybe decreased sport performance there. She has her knee pain, right? The mild anterior knee pain. And her family, though, wants her to step up her training. They're thinking maybe she needs to do more. Maybe she's falling behind because she's not doing enough. So if the family comes in and they're thinking, well, what else can we do? Should she be cleared to increase her training so that maybe she does more so she can be doing better? Or should she be cleared to stay as she is? Should she take some time off? Should she maybe switch to something else? And what do you think? What do you think she should do?
I think she should take some time off because I feel like especially if the family wants her to increase training, that might worsen the knee pain that she has and like hurt her later down the line.
Mhm.
So I think even though she feels behind right now, I think taking that time for herself to heal is more important in hopes of getting back in the level of her teammates and like not risk falling even further behind by playing on the hurt knee.
Okay, very good. Yeah, pull back so that she can eventually advance further.
Mhm.
Oh, sorry, you go.
Oh, sorry, you can go.
Okay, thank you. I agree. I think that lowering the intensity of her training would help her a lot, and just focusing a lot on recovery. And it would definitely help with her mental health as well. For family, put less pressure on her because she could really bounce back a lot sooner if she focuses on recovery and making sure she's at like in peak physical health before you know getting back to it.
Yeah, like Kevin, I also come off based off experience. I play tennis and I used to play all year as well, and I didn't have many breaks, so it eventually did lead to burnout. So that's why I did take a break. And um, what's funny is when I actually went back into the sport after a good couple weeks, I played better than I had ever before when I was actually playing more consistently. So I would definitely go with number three. She take some time off because it becomes a big part of your life. And then I'm someone who cares a lot about the things I contribute my time to. So then that does lead a lot to overthinking and anxiety. So it did help me feel more confident in the end because, like we just discussed, I went back to other hobbies that I did, such as painting or reading, and I got to know myself more than just a tennis player.
Yes, that's excellent.
I'd like to add on, I definitely agree with Isabella and everything else everyone else has said. I think that she should take a step back from her sport, but also increase her other hobbies and define what it means for her to be a person outside of soccer.
Excellent. Excellent. Okay, well, very good. Anyone else?
I wonder if like cross training would help her, like not necessarily switch to another sport, but maybe if she still wants to get some exercise in, like doing swimming, which is like a low impact sport for her knee.
Very good. So, what you guys have kind of all kind of hinted at or thought about is just there's this tension, right, in youth sports, and you've got your performance, you want to do well, but you've got your health, you want to be healthy, right? You want to be well. You've got the short-term success and the lifelong long participation, right? So, trying to stop and take a pause is kind of hard because you feel like it's going to set you back, but then in the end, as you all have said, that maybe it could be beneficial for her. And then you've got the parents' goals and the child's goals, which are not always in alignment either. So when you're thinking of counseling, though, because we've all said, well, we think this young lady would benefit from, take some time off, maybe switch to something else, cross train. There's you've got to think of a way of how you would approach that, right? Because just saying, well, I think you should just stop, that's not going to work, right? I'm sure if somebody said that to you, you would be like, no, I mean, I've been doing this my whole life. I've been doing this for, 10, 15 years. I don't want to stop now. I'm almost there, right? So ways of thinking about counseling are kind of ways of kind of prompting someone to consider on their own, what their behavior is doing for themselves. So you can use like the sports counseling framework. So just to think first, the S is specialization. Do you play other sports during the year? Or do you specialize in only one? And when you ask that question, that might get somebody to think, oh, wait, should I do more than one? Because some people might not have thought about that. Some people might have only done the one and they haven't thought, oh, I could do something else. I hadn't considered that. Do they have any pain, right? Is there any pain that lasts more than a few days? We've all had, new practice session or new skill that we learned and we're sore, and that doesn't last very long, right? But if someone's got pain that continues and becomes a continued pain or chronic pain, then that's concerning. Do they have any off seasons? So how many months do they take off? And if when you ask that question, somebody might say, oh, should I, right? I didn't really think about it. I just kind of keep going. What about recovery? How much sleep are they getting? Are they getting good sleep? Right? Because sometimes people go to sleep, they lay there in the bed and they're not sleeping well. Do they feel time pressure? Do they feel like they have to keep playing? Or do they feel like they can take that time off, right? So these are all things just to kind of have them consider for themselves, is this the life that I want, that I just kind of can't stop? And then what about stress in school, right? So is it affecting their mood? Is it affecting their grades, in their interactions with their family and friends, the rest of their life, all those things. And if you ask these questions, a lot of people will, hear the question, they might answer it right away, but then they might think about it later and think, well, gosh, maybe I should change what I do, right? Maybe I don't need to have it be like this. So other things, so definitely when we see people in clinic, and we're worried about burnout, sometimes we worry about more than burnout. We might worry about depression or anxiety, and there are actually validated screening tools that we will use in clinic. So there's something called a PHQ-9A, which is a tool adapted specifically for adolescents to assess depressive symptoms that last over 2 weeks. Then there's a PHQ-4, which is actually on the printed pre-participation physical evaluation. That's an abbreviated version of the PHQ-9A. So those are also very helpful for adolescents and depression. And then there's an anxiety, so it's GAD-7. It's a 7-item self-report questionnaire to help screen for generalized anxiety disorder symptoms. And then the International Olympic Committee actually has two tools that can be used. One is a sport mental health recognition tool that can be used by family, peers, and coaches to help recognize early warning signs. And then there's an assessment tool that can be used by a provider in clinic. So this is something that people can talk about with the family and the athlete and say, as a provider, I'm worried that you could be overdoing it. What do you think, you, the athlete, think about giving this tool to your family and friends and your coach and see if they fill it out, if they can help us see, how you're overdoing and in what areas. And then that way you've got more of a team approach to helping this person because in the end, you need the family, the friends, and the coach to be involved because they're going to be part of that person's identity if they lose their sport, right? Or if they leave their sport. So this young lady comes back a few months later, and she's thought about the questions that we asked, and she thought about what I should probably get more rest, and then she's thinking, well, maybe I need to get more sleep as well, right? Rest is different than sleep, and then I used to love playing, but now I'm just kind of playing to work, playing to get into college, and maybe I don't want to do that like that. So she thought about it and she said, who would I be outside of soccer? And she decided to not try out for the team. So she kind of skipped it. Her mom was upset, right? And I know my sister's twins are going to college next year. It is super expensive. So I'm sure part of her mother's hope was that she would get a scholarship to college. So I know that could be upsetting for a parent. And then the coach was surprised because she has been an all-in athlete, right? She played all the time. She played whatever position was needed, right? And now she's like, I'm leaving. So that would be a surprise for the coach. So instead, this young lady joins the track team. And amazingly, her knee pain improved because now she's training appropriately, right? She's not overdoing it. Her grades improved, although she was a straight A student. It's easier for her to complete her work. She's going to the movies with friends. She's playing a weekly game night with her family. So she has another life, right? She feels better and she feels more balanced. So then if you ask her, if you stop playing, who would you be? And she says, I'd still be me because she's got a whole nother life outside of her sport, right? So when we think about youth sports, we need to think about the goal, right? So we just think we want to get them moving, right? And if you look at little kids in clinic, it's super fun. They actually don't stop moving ever, right? They're pretty much moving all the time, and you have most parents saying, "Sit down, sit down, sit down, sit down, sit down." But the goal is for kids to be moving their bodies, regardless of what they're moving their bodies doing, right? And to enjoy it, right? So that's the goal. But it could also be that the goal is not just movement, but it's movement for a lifetime, right? We don't want them, just moving as children, which we're seeing now. We're seeing kids are moving more as children and they're kind of dropping off in how much movement they have throughout the day as they get older. But we want them to be physically active for a lifetime, right? We want them to be enjoying this forever. So the goal really is a healthy and enjoyable lifestyle with movement, right? We want them to be always active, right? We want them to be joyfully active. We want them to be balanced in their activity. You don't, as an adult, you can have some adults who will overdo different types of fitness programs too. We don't want that either. We want balance in our activity throughout our lives. We want them to enjoy it, and we want them to be a healthy person. So that would be the goal: a healthy and enjoyable lifestyle with movement, right? So when we're thinking, kind of what to think about or take away from this, just think specialization before adolescence increases overuse injury, risk, and burnout. Rapid load spikes can be more dangerous than a chronic high load, although chronic high loads are not good either. Burnout is not just motivational, it's also medical, right? So there's certain things that happen. It's like a syndrome of things that happen with burnout. Sports participation can affect an athlete's mental health for good and for bad. And every sports physical is an opportunity for anticipatory guidance. That's, guiding on, lifestyle and other things that can be helpful for that person to be a healthy person. So when thinking or kind of thinking like a phrase to think about performance is temporary, right? It's what you did that moment, right? But health is lifelong, right? And that's our goal. We want somebody to be healthy forever, right? We want them to be moving forever, right? So here's some references for my talk. And then I've loved some discussion. So any questions or comments?
Yes, thank you for that wonderful presentation. I personally loved all the gifts. Is there anything that Dr. Lopez would like to add or any questions anyone had? We can start with you, Jack.
Like, yeah, I just want to say I didn't know I think it was called the SMHRT.
Mhm.
I didn't about mental health. I didn't know that was a thing, and I really like how you interview other people within like the athlete's life to get like a gauge of what's going on with their mental health as well and like where they can improve. I really like that. I didn't know that was a thing. So
Yeah, and I will say generally in clinic, we will talk with the parents and ask them, what do you think, about, the participation, especially when you have a young athlete who's overdoing it. Is there a way that we can kind of pull back on some of the activity? Because you definitely need the family involved. Yeah. Isabella.
Hi, thank you for a great presentation. I was curious. So, this talk about mental health, I was curious how you would integrate mental health training into an actual team.
Oh, that's a good question. I think the thing starts with the coach, it starts with the coach, right? And how they're putting their training schedules in, and if they're actually allowing time for the athlete to be another person and not just an athlete. And I think it starts also with, the coach, the assistant coach, uh, getting together and planning some time where they can talk with the athlete about their mental health, right? And other things that they're doing in their lives so that they don't just have an identity as, the athlete for the team. And that should be something that, especially when people are finishing, like so you've got an eighth grader who's finishing their sport there, a 12th grader finishing or a college age athlete finishing, and they're not going to go on to the next level of sport, then they're going to need some help, right? To help adjust to, first of all, being an active person otherwise, right? Because sometimes if you play soccer forever, you might not have another way of being physically active, but also just to be a healthy, balanced person outside of doing that. And that's something that really should be part of what the coach teaches throughout their kind of time with the athletes. So not just on the field or in the weight room, but also just some time to sit and be people. Mhm.
Thank you. I completely agree.
Kevin?
Yeah, I kind of just want to get some insight on something. So I recently talked to a physical therapist who had experience with a marathon runner.
Mhm.
And they had the conception, or they've had the conversation with them saying that after a period of running for a long time and training for a long time, um, there's like a part where once they cool down, they have a lot more pain in a lot of different joints, and they have actually increased pain when they stop playing. So I just want to get some insight on if you ever had experiences like that and like see what you would do if somebody expressed more pain instead of less pain when they stop training or decrease training load.
Well, it could be partly because I have seen some people. I had a dancer who came in and she had stopped dancing and she started having knee pain. And I think part of the problem was that she didn't replace it with anything else. So she just stopped doing the dancing. And maybe the dancing and the training for the dancing was helping a little bit with some of her the natural imbalances that we have in our body. And so now those imbalances are coming out and they're causing her to have some issues with pain. So that's what I would probably say, something like that. It could also be that that athlete has changed other things, so they might have changed their diet, their sleep might be different, and other behaviors. And so those other things could also contribute to their pain. Mhm.
Thank you.
Mhm. Jordan?
Hi, thank you for taking the time to present today. I have a little bit more of a personal question. Have you had any patients ever who pushed past their injury at first because it was smaller in hopes that it would naturally get better, but this actually made their injury worse? And if so, how did you as the physician deal with this?
I have. And I I try to, well, I try to kind of, first of all, warn the athlete, it's like, oh no, this is going to make you have more injuries. This is going to make things worse. So I always counsel on that. I counsel on making sure that the technique they use, can be affected by their pain. And so if their technique is poor, then they can have pain other places, and that pain could be more longer lasting than this current temporary pain that they have. I also will counsel them and say, and if your technique is poor, you probably won't do as well. So I try to do that. But I have had people who have continued to play and have had, progressive injuries. And in the end, they have not been able to play. And then that's been very hard too, to tell them, you really need to stop because you're, at the end of a long line of injuries that are going to become very severe soon. And at some point they do understand, but at that point, then the recovery time is much longer. Mhm. Yeah. And so we've had to, write letters to, schools and sports programs to let them know that they're unable to play and to excuse them from that time if it was a club, so that they can heal appropriately. Mhm.
Thank you.
Aaron?
Hi, thank you for your presentation. I guess I have sort of a similar question, but how do you approach cases of young athletes where their training is too much, but they insist on continuing their schedule and like are afraid to fall behind? Like, do you continue to try to persuade them to take on like a lower schedule?
Yeah, you do your best, right? So, depending on the age, so if they're under 18, then you've got a parent there who can also be helpful, and we try to kind of talk together, because this is this young athlete's body, this is what the body they'll have forever, and you want them to be healthy and well the whole time, and I think most people want that. Even the parents who want their child to go to school on this particular sport still want their child to be healthy and happy. So we try to work through that. It can be very hard for people to stop a sport, especially when that sport is considered their vehicle to get, a career, right? So if it's or to get to a career. So if you're just trying to get to college and you want to go to college on a basketball scholarship, and you're not going to play basketball in the pros, you just need college, you need basketball for college, then it's hard to give that up. But I will just talk with them about all the different things that they can do that might help them still with their training. So if we can change, maybe cross train for a period of time, that still benefits them in the end. So we'll try to work with that. Angelica.
Hi, Dr. Coleman. Nice to meet you. I just kind of had like an opinionated question. So as a pediatrician, do you think the overall benefits of athletic participation on a child's mental health like outweigh the potential risks we talked about? So like injuries, burnout, and like identity issues? And if so, like what impacts do you think contribute most?
I think appropriate physical activity is a benefit. I think the problem is when people are overdoing it. So I think overdoing it, it puts them at risk. It puts them at risk for injury. And for those who are doing sports that with early sports, specializing sports, they also can be isolated. They don't have the same contact with their peers. They don't have the same contact with the world. They're literally in a different place, right? They spend a lot of time in their training, and that can be very difficult. Yeah, so but appropriate physical activity, appropriate sports training, I think outweighs the general benefits of having an ankle sprain or something like that. But it has to be appropriate. Yeah.
Thank you.
Mhm. Hunter?
Hi, Dr. Coleman. I had a question about kind of the parental side of this. Your presentation focused kind of a lot about helping the athlete kind of discover themselves outside of sports and also um, kind of bringing them to realize that sometimes sports you can burn yourself out and you can overtrain. But how would you address athletes with parents who are kind of overbearing and who are kind of the root pressure of root of all the pressure on their athletes?
I I will usually try to be a little bit more direct with the parents, and just say, we're risking injury, we're risking their future career if we continue with this way. So I can be a little bit more direct with the parent than I can with the athlete. So I usually will try and do it that way. Yeah. Because we all have the same goal. And I know that most parents don't want their athlete injured, right? They want their athlete to be healthy and happy. They want their athlete to have, college, acceptance or a career. And so we're all on the same page. But just to try and let them know that the way that we're going is not leading to a healthy young athlete.
Thank you for your time and your response to my question.
Oh, thank you. Is it Taya?
Taya. Hi, Dr. Coleman. Kind of similar to Hunter's question, I wanted to ask that given mental health is still kind of stigmatized in some cultural contexts, how do you navigate conversation with patients and their families who may be hesitant to acknowledge mental health concerns tied to sports participation?
I think one way of talking about mental health without necessarily using like that kind of phrase would be maybe talking about, athletic identity and that definition, right? Which is just, it's how much of you is your sport versus other things you do. So if your whole day is school and then soccer, then you don't have really a balanced day, right? So I think it'd be more like talking about the things that lead, to, a negative athletic identity and the things that lead to burnout and looking at those specific criteria, so to speak, as opposed to, saying, depression or anxiety, but really talking about the specific things that we might see or find on history or an exam.
Thank you.
Brendan?
Hi, Dr. Coleman. I just have a question about similar to Taz that around this idea that like this side of mental health is not really talked about. I'm just wondering your thoughts that should it be taught in schools like through either a class or a workshop that will help most athletes learn about this because I feel like a lot of athletes don't realize about burnout, about like the mental side of sports until they've already experienced it. I'm just wondering your thoughts on that.
Yeah, I think it would be great if it was something that uh, that we, that we have coaches actually. I really think it's part of coach training that should include this. And so that the coaches know that, yes, we're going to do this stuff on the field, we're going to do this stuff in the weight room, and we're also going to do this stuff like in a classroom or in a family room or something like that. We're going to talk about these things. I think it should be something that is regularly done. And I think it shouldn't be stigmatized. It should be something that we just do. We talk about these things. And I think that's just the thing that we struggle with in medicine as well. In different states, there's different restrictions on or different I don't know, it's not restrictions exactly, but different questions that come up when you're licensing for or redoing your licensing for medicine, and they ask about different mental health things that you might have had in the past or what you're doing now. And it can be stigmatizing. People don't want to talk about it. And instead, we should really say, well, we encourage everybody to get the help that they need at any time. We encourage people to talk about these things because it's helpful to share with other people, your concerns about this, just like you would about your knee pain. So I think that's the thing is to really have it be an open thing that's just part of regular practice, part of regular day. Chris?
Hi, thank you for an amazing presentation. We really appreciate it. But going back, we read an article before this meeting, and I saw a stat that stuck with me that was 85% of youth coaches were untrained volunteers in the year 2000. I think I've had coaches that have been like untrained volunteers, making us practice too much, too little. How do you think we can go about getting more facilitated training so that these coaches are not caught the reason for the burnout or injuries or anything along that line?
Well, we've got different states have state athletic associations that can help with training for coaches, and actually coaches also have associations that can help with training for them. The difficulty is that we have all the different levels of youth sports, and I think it's difficult to get all of those levels and have all the requirements for training. That it's just hard to do. Just logistically, there's a lot of little youth groups all over participating in different types of sports, and then it also costs, right? It costs a lot. So it's hard to get all those people those training and then keep them up to date. And so that I think logistically has been difficult. Although I will say all those coaches that are out there, they don't want bad things for the kids. So I'm sure they would appreciate the training that they can get, but I think it's difficult for them to get it all the time.
Thank you.
Mhm.
I also have a question real quick. Thank you for the presentation. It was really well made. Um, in your career, have you ever seen a trend where like a certain demographic or cultural identity had a more often rate of injury due to like parental pressure or various other factors?
Not really. I mm, I would say different. I think I've seen different demographics have their reasons for going, for overdoing the sport, whether it's because everybody in the family did this sport, and so you're expected to do it, or people who are trying to do it so that they can go to college. I've seen different demographics kind of go down that road. It depends on just depends on, that unique person, but it happens to everybody. Hunter.
Hi, I have another question, kind of about overtraining and the mental health side of your topic. Um, Obviously, as we've grown as a society, mental health has become slightly less stigmatized, and there's been more advocacy for mental health. Obviously, we see pro players kind of taking breaks from their sports in order to be better themselves and be more mentally healthy. Have you seen have you seen a trend in understanding of mental health as related to sports? Has there been a decrease in overtraining and pressure, or have you seen the opposite where now more people are starting to start sports at a younger age and thus have more pressures built on them and there's actually an increase in, I guess, burnout rates?
I don't know necessarily, at least in my patient population, that I've seen an increase in burnout rates. Although I think people are more aware that, of the potential, right? So they know that, they don't want their child to overdo it, but they do want their child to do well enough, to continue on. So I think people are more aware of that kind of, this or that tension. But so I don't know that I've seen an increase in burnout rates. I feel like it's maybe stabilized or maybe gone a little down, at least in my patient population.
All right. Thank you all so much for the questions. Do you guys have any other questions? Or Dr. Lopez, would you like to add anything?
Yeah, thank you, Dr. Coleman. That was a phenomenal talk. I guess, and I have to bring it from a perspective. I know you were focusing on sports specialization. Now, if you have one of these athletes and they do get injured, I think that's something that also needs to be concerned because uh, I think when the athlete injures themselves or they get injured, they also could lose their identity and they find themselves in not so much for say, but in a vacuum because they're trying to they've only paralleled themselves with the sport, and therefore when they're injured, it's almost a time of loss for them. They actually have it's known to have they have academic challenges. They also have social challenges because they can no longer be so much that's why you often see injured players with their team out on the fields. I think that's something that we need to kind of keep into consideration that maybe we should tell them instead of being out with the team, and I know they want to be out with the team, they should be resting and getting better. But it's a hard sell due to the fact that, the athletes are so, I think one of the students had said, they're very eager to be part of that team and be with that sport. But I do think there's a fine line when these athletes are specialized and they get injured and they find it hard for them to kind of pick another sport.
Yeah, I think it can be devastating. And they did a study, I think it was a while ago now, and they said, if an athlete can't be in their sport, whether they're cut from the team or they don't make the team or they're now not able to play, it's like failing a grade in school. It feels the same way. Having their parents divorced, it feels the same way. So it is a significant effect on their mental health to not be able to play the sport that they had kind of designed for themselves. Yeah.
Yeah, it's something to keep at least consider that you have to address that as well.
Yeah. Yeah, and it can be devastating to tell an athlete that they can't play. That it hurts everybody. And then they can have a significant mental health concern then, and so really trying to work on having mental health support for them as they are recovering from their injury, or if they had another medical disqualification, having to help them through that too. And then keeping them active though and helping them transition to something else that they also find enjoyable.
Another point I'd like to bring up, and that is, I think it's hard, as you had alluded to, that trying to get certifications or upkeep on certifications. So even though this would be a great module for coaches, it's not in their priority list to try to keep that kind of module up in the top pyramid for them to really kind of employ. They have other things that they want to do. So I think it's a fine line between the athlete being educated and the coach being empathetic about what's going on with the athletes. So there's a fine line of coach training that may be needed, but I don't know if it can be ever employed fully, as you had said, Dr. Coleman. And that's always a challenge, because I think when you deal with these coaches, their vision is trying to get to field the field.
Mm-hmm.
They want players to field the positions that they need.
Mm-hmm. Yeah, I think it is a challenge. And even injury prevention programs it's a struggle to get coaches to do those. And I think one way that they've worked on testing them and getting these injury prevention programs out there, like for ACL injuries, injury prevention, is to say this will also enhance the performance of your athletes. And actually, that was helpful. So thinking about supporting the mental health of your athletes as a way of also enhancing their performance might be another way of getting the coaches to give it more credit than they give right now. Because I know they've got so many other things that they've got carrying what that they're doing.
Yeah, they're probably, as Chris said, these coaches are volunteer coaches, so they're managing the team. They're also, doing the budget for the team as well as trying to coach the team. It's a system that again has been going on for a very long time. I don't know if we're going to be able to change that machine like that, but again, chipping away at it to try to see what you can improve for athlete wellness is always key.
I agree. Mm-hmm.
Well, thank you all so much. This will conclude week 2 of the Rugby Research and Injury Prevention Group Summer Lecture Series. We'd like to give a big thanks to Dr. Coleman today for joining us and everyone in the audience for attending. Thank you all.
Thank you for having me.